Hello everyone, Homeopathy Heals welcomes you in today's video. Today we'll be discussing about the sign and symptoms and investigation of diabetes mellitus. Before discussing the sign and symptoms, one thing I would like to discuss is the normal range of blood sugar in human body. For fasting, it should be less than 100, and for random, it should be less than 140. So if a patient comes with the report of its blood sugar between 100 to 125, then he or she should be considered as pre-diabetic. When random blood sugar of a person is more than 200, then the sign and symptoms which he gives includes polyphagia, which means excessive hunger, polydipsia means excessive thirst, nocturia means frequent urination urges, desire at night. In spite of that, tiredness, lethargy, dizziness, irritability, dry mouth, weight loss, decrease in concentration, no desire to work, that work which is domestic, which is important for daily life and activity, patient loses its interest in doing any kind of work. There is craving for sweet. Another very important feature of diabetes mellitus is pruritus vulva. That is, there is intense itching in vulva and vagina. Patient may also be associated with blurriness of vision, numbness and tingling of extremities. Coming up next is the ketoacidosis. As we have discussed in previous video that diabetes mellitus causes ketoacidosis, which is a major medical emergency, and it is serious because it has high morbidity. In ketoacidosis, patient has decreased appetite, which is very much contrary from hyperglycemia, where patient is having polyphagia. In ketoacidosis, patient has recurrent infection, septic or even cardiac disorder or MI. One thing we should keep in mind that hypertension is present in 50% of patients, those who are suffering from long-standing cases of diabetes mellitus. The cardinal biochemic feature of ketoacidosis is hyperglycemia, hyperketonemia and metabolic acidosis. The signs for ketoacidosis is air hunger. Patient craves for air, for breathing. The extremities are cold, tachycardia, hypothermia, and lips are cracked. Patient is in stage of metabolic acidosis. Another feature is lactic acidosis, which may also be associated with diabetes mellitus, and it causes 50% of morbidity in cases. Another very interesting thing is, if I would tell you that cases of diabetes mellitus may suffer from hypoglycemia. Yes, which is not due to disease manifestation, but due to the drugs, the treatment which is decreasing the insulin in the which is causing a decrease in blood sugar in the human body. The symptoms of hypoglycemia may be poor vision, dizziness, chronic fatigue, patient always wake up with the morning headache, poor quality of sleep, vivid dreams, restlessness, profuse sweating, twitching of different kind or different group of muscles of the body, anxiety, palpitations, pounding heart, confusion of mind and irritability. There is one syndrome known as dead bed syndrome or dead in bed syndrome. It is characterized by the death of a patient, those who are suffering from type 1 diabetes, that is insulin dependent diabetes, and they die overnight in their bed due to excessive or extreme hypoglycemia. Their body shuts up due to insulin, which causes extremely decrease in insulin. Now coming up on the investigations which are desired, which are required in cases of diabetes mellitus is very basic, is a blood sugar test. We do it for random and we do it for fasting. In random, it is irrespective of what we have ate and at what hour of the day we are doing the test. But in fasting, we don't eat anything overnight and we do the test early in the morning, empty stomach. There is another test, initial glucose challenge test. This test is done in the pregnant females, those who develop gestational diabetes. It is very important to follow up pregnant ladies, those who are suffering from gestational diabetes. I repeat, follow up is very important for such cases. Next test is glycated hemoglobin A1C test, that is HbA1c test, which is very much in trend these days in medical field. First of all, it does not require any kind of fasting, or it is irrespective of what you have ate an hour of the day, and it indicates the blood sugar level for past 2-3 months. The higher the blood sugar rate in the body, the more hemoglobin with sugar attached we found, because we know that life of hemoglobin is of red blood cells of 120 days. So the range for HbA1c test is when it is up to 5.7, it is extremely normal. When it is between 5.7 to 6.4, then patient is pre-diabetic, and when it is more than 6.5, then patient is at risk of diabetes or he is suffering from diabetes. So I hope you like the video. Write in the comment section, and yes, the question for today's video is that you have to tell that what are the cardinal biochemic features of ketoacidosis. Share with your friends, write the answer, be the winner. Till then, stay fit, stay healthy, homeopathy heals.